Welcome back. Thanks for staying with us. On the backdrop of the State of the Nation address that will be delivered this evening by President Cyril Ramaphosa lies a serious health crisis. The South African Medical Association trade union says the National Health Department has shown poor prioritisation in the appointment of doctors in various public hospitals and clinics. SAMATU had indicated at the end of last year that over 200 community service doctors faced unemployment in 2023. Newzroom Afrika's Nobuhle Modise is on the story. Nobuhle, very good morning to you. A crisis, 200 doctors is really a significant number. What are some of the expectations as the President delivers the State of the Nation address in the midst of this crisis?
Indeed, a very significant number, and you will remember that just 2 weeks ago on the 26th of Jan, members of SAMATU did partake in protest action, and they marched in different provinces to, the offices of the premiers here in KwaZulu-Natal. They did march to the premier's office of Premier Nobuhle, just to, highlight many of the issues that have come up within the health sector, particularly in public hospitals and clinics, where in KwaZulu-Natal alone there are about 400 doctors that are sitting unemployed, and the department has basically told them that there isn't a budget, there isn't any money to hire them. And you will remember that last year during the President's State of the Nation address, he did in fact mention that about 56,000 health workers had been recruited and 46,000 had been absorbed into the system. But that's a completely different picture from what SAMATU is saying. When they marched 2 weeks ago, they did mention that there's about 1,000 nationally health workers, doctors rather, that are sitting without jobs rather, and the department is basically just saying to them that there isn't a budget to hire them. And many of them are saying what is there left to do other than going into the private sector or going overseas. We're still waiting for the health department in this regard to get back to those doctors regarding their demands. And this is happening also, in the backdrop of a health crisis in the country. You know that the public health care system is known to be failing. A lot of public hospitals are in a dismal state. They're understaffed. And what SAMATU is saying, those workers that are working in those public health care facilities are overworked, which then obviously trickles down into the quality of the services that patients are getting at the hospitals, because they're just not equipped enough to deal with many cases within the public health care sector. So SAMATU is just saying that the government's priorities seem to be shifted many times, and whereas they know that the public health care system is in dire straits, and what is needed is for more doctors to be hired at this point, but many of them are sitting at home. Like I said, that number in KZN, there are about 400 doctors that are out of employment, and I will be speaking to some of them later on today, at midday rather, and just speaking to them about what this means to them, and if they will also be one of those who are going into the private healthcare sector, because the public healthcare system is telling them that there simply isn't a budget to absorb them into the system.
What does this now mean for the state of hospitals? How are they within the medical space feeling the pinch with the shortage?
Indeed, those who are, in the employ of the public health care system are indeed feeling the pinch, because then they are overworked, they're working longer hours than they should be, yet there is, a need for more doctors, and the public health care system is simply saying that there isn't enough budget. And this is what SAMATU is saying, that most of the provincial health departments have told doctors after they do their in-service training that they simply can't absorb them into the system because there is no money for them. And this, like we're saying, is in the backdrop of already an understaffed hospitals like the one I'm standing in front of, Addington Hospital. There's a number of issues that happen at public healthcare facilities, and we know that many of them have to do with understaffing, and the department is simply saying that they don't have the money to absorb those doctors who come here after they graduate to do their in-service training.
Very well. Let's leave it there for now. Of course, as we continue throughout the course of the day to hear more as you interact with some of those doctors. Nobuhle Modise coming to us from the speaking about the South African Medical Association trade unions concerns. We will bring you that throughout the course of this morning.